Prescription Drug Misuse, Abuse, and Addiction, Health Concerns by Colby Anderson. Prescription drug abuse can be defined as taking a prescribed medication in a manner or dose not intended by the prescribing doctor. This includes using a prescribed medication without a prescription, taking a medication in greater amounts or more often, using a medication in any other way that is not directed by the doctor. This would include altering the route, such as swallowing, injecting, or snorting the medication. There are three classes of medications most commonly abused. Opioids, also known as painkillers. They are usually prescribed to treat pain and are the most misused prescription medication. Some of the medications are oxycodone, oxycontin, Percocet, hydromorphone, Dilaudid, hydrocodone, Vicodin, Norco, and Lortab. CNS depressants, also known as sedatives, tranquilizers, or hypnotics, are used to treat anxiety or sleep disorders. Some of the sedatives or tranquilizers would include Ativan, Phenergan, Klonopin, Valium, and Xanax. Hypnotics would include Ambien and Lunesta. Some of the stimulants, they are most often prescribed to treat attention deficit hyperactive disorder, also known as ADHD, and they would include Adderall and Ritalin. Profile description of the population. Prescription drug abuse is becoming a huge problem and a deadly epidemic in the United States. The prescription drug misuse varies by age, gender, and accessibility of the prescribed medication. The population age group most commonly associated with prescription drug abuse are youth between the ages of 12 and 17, which make up 3% of the population of the individuals who take prescription medications for non-medical use. Young adults, age 18 to 25, are among the highest percentage of the population abusing prescription drugs at 5.9%, according to the National Institute on Drug Abuse. There is also a growing problem with misuse of prescription drugs among the older population. Elderly, age 65 and older, are at a greater risk for misusing drugs because they are oftentimes taking a variety of medications and can double up or exceed the recommended dose prescribed. Gender for this population consists of both male and female. According to the Center of Disease Control and Prevention, adults aged 20 to 59, prescription drug use was lower among men at 37.5% than women at 55.5%. Profile size of population. I was unable to find anything locally. However, statewide in the last year, 117,000 Utahns over the age of 12 misused opioids. In 2019, the number of drug-related deaths in Utah accounted for 26 deaths per 100,000 in the male population and 20 in the female population. From the year 2000 to 2015, there has been a 400% increase in deaths related to misusing or abusing prescription drugs in Utah. Nationally, in 2018, an estimated 16.9 million Americans misused prescription psychotherapeutic drugs in the past year. Results from the 2018 National Survey on Drug Abuse confirms that 9.9 million people misuse opioids, 6.4 million people misuse tranquilizers or sedatives, and 5.1 million people misuse stimulants in the past year. Also nationally, 48 million people aged 12 and older have misused prescription drugs in their lifetime. The number of drug-related deaths in the United States in 2019 account for 19.2 deaths per 100,000 population. Internationally, in 2016, 275 million people, or 5.6% of the global population aged 15 to 64, misuse prescription drugs at least once a year. Differences in population size locally, Utah compared to nationally. In 2017, there were 456 drug overdose deaths involving prescription opioids in Utah, a rate of 15.5 deaths per 100,000 persons compared to a national rate of 14.6 deaths per 100,000 persons. This shows that the prescription drug population in Utah is larger per capita than the national population. I think that a big reason for this is the LDS religion here in Utah. Many of the members perceive that medication is much safer and because it is prescribed by a doctor, and so they start using it and then become addicted. Contributing factors, social determinants of health. There are multiple social determinants of health that can affect the health, function, and quality of life for this particular population. Prescription drug misuse, abuse, and addiction can be caused or influenced by biological, social, environmental, psychological, and genetic factors. This can be broken down into 3 categories: social and cultural environments, economic environments, and physical environments. Social and cultural environments, a person's age, gender, race, ethnicity, values, beliefs, roles, sexual orientation, and expectations all affect the way one may begin using, abusing, or becoming addicted to prescription drugs. Family structures, such as how an individual is raised, parental influence, or lack of supervision, also peer influence, role models, social network, advertising, and promoting of medications are all contributing factors of drug misuse and abuse. Economic environment, people living in poverty or low-income communities are more vulnerable to drug abuse because of financial stress and insufficient community resources for treatment. There is often less access to support systems, healthcare, and community organizations. Other economic factors include the availability of prescription drugs, the lack of education or knowledge about drug misuse, and unemployment. Physical environment, as individuals are exposed to prescription drug abuse and aggressive behaviors as a child, this can potentiate one's ability to develop similar patterns of misusing medication. Other contributing factors are the experimentation of prescription drugs, the availability of drugs at school, in the community, and local gatherings. By understanding these factors, it is important in reducing prescription drug abuse and improving the health and safety of individuals. Contributing factors, specific concerns. Prescription drug misuse can lead to abuse and possibly addiction, causing serious health risks and medical consequences. Short and long-term health issues associated with inappropriate prescription drug use. Some of the physical concerns are elevated body temperature, irregular heartbeat, shallow breathing, constipation, disorientation, and seizures. Some of the psychosocial concerns would be peer pressure, media portrayal of substances used by celebrities, expectations of joy, lucrative advertisements, and attractive packaging. Some of the economic causes, based on the data from the 2013, the annual U.S. cost of prescription drug misuse estimated to be around $78.5 billion. Some of these costs went into drug prevention, treatment, workplace productivity, and crime-related costs. Contributing factors, specific concerns continued. The increase in prescription drug misuse over the last 15 years reflects an increase in emergency room visits, prescription drug overdose deaths, treatment admissions for prescription drug addiction. Overdose death between 1999 and 2017 involved prescription opioids were 5 times higher. Between that same time period, more than 700 people died from drug overdoses. And of the 70,200 overdose deaths in 2017, 68% were related to opioids. Contributing factors, root causes. So why is prescription drug misuse, abuse, and addiction becoming a huge problem around the world? The main root cause of prescription drug use among teens and adults are increase in access and availability of the prescribed medication. They want to increase their euphoria or to get high, to relax or relieve stress, to increase alertness or suppress an appetite, help with sleep, experimentation, peer pressure, acceptance of others, to increase work performance, concentration, or academics. So why is prescription drug becoming easier to get? There's been a significant increase in prescriptions issued by doctors over the past 2 decades. Contributing factors, Maslow's hierarchy of needs. Some of the needs that are met in this particular population would be psychological and esteem, or physiological and esteem. Individuals who become addicted to prescription drugs or other illegal substances will participate in risky behaviors, oftentimes becoming more sexually active. Their basic sexual needs are oftentimes met in a lifestyle of drug abuse. The self-esteem needs of this particular population can be met as their confidence is increased with the reaction of the drug. Some of the needs that are unmet, much of Maslow's hierarchy of needs are not met with this population. During an active addiction, drugs can little by little become top priority over one's basic needs, even survival needs. They are now focusing their main focus is on the drug of choice. As addiction progresses, they become less and less concerned about safety and are willing to live on the streets to maintain access or use of the drug. The needs of love and belonging are oftentimes not met due to poor family or friend relationships because of their addiction. Their self-esteem can become unmet as they struggle with school, work, or other activities that reflect poor performance. Also, self-actualization is unmet as their continued focus is on using drugs with no accomplishments in life. Some of their anticipated functional level would be low due to unfulfillment of a majority of Maslow's hierarchy of needs and taking mind-altering drugs. Functioning level of this population tend to be lower as much of their attention is focused on drugs and getting high. Their likely health outcomes: without professional help, adequate support, and a personal desire to quit, the health outcome of this population is very poor. They can develop severe long-term health problems with extended or continued use of drugs. Such problems include heart or lung disease, cancer, mental illness, HIV, AIDS, hepatitis, and others. Specific concerns: communicable disease or infections. Misuse and abuse of any mind-altering drug can impair the judgment and inhibition of an individual. This combination can lead to participation of risky behavior such as needle sharing and unsafe sex, which increases the likelihood of contracting sexual transmitted infections, hepatitis, and HIV. Some of the sexual transmitted infections would include chlamydia, syphilis, trichomonas, gonorrhea, and genital herpes. To decrease the spread of communicable disease or infection, the best preventive measure would be avoidance of abusing mind-altering drugs, safe medication storage, disposal, prescription drug monitoring, education, and seeking professional help and treatment to overcome addiction. Specific concerns: non-communicable disease or infections. Opioids cause respiratory depression, constipation, drowsiness, nausea, neonatal abstinence syndrome, hypoxia, brain damage, liver damage, overdose, and death. Depressants can cause heart problems, depression, liver failure, suicidal thoughts, hallucinations, lack of coordination, shallow breathing, high blood sugar, slurred speech, seizures, chronic fatigue, suicidal thoughts, tremors, coma, overdose, and death. Stimulants can cause liver failure, kidney failure, cardiovascular failure, memory problems, irregular heartbeat, paranoia, elevated body temperature, decreased appetite, increased blood pressure, and death. Some of the preventive measures for this would be taking the medication as prescribed by the doctor and education. The community and the vulnerable population need to be educated on the dangers of prescription drug abuse and the harmful impacts that it can have on their health. Specific concerns: self-care, self-harm. Many people use prescription medications to self-medicate, relieve stress, or to cope with reality by numbing their feelings. Studies found that approximately 8.7% of individuals presenting with intentional self-harm also abuse drugs. There's also a greater risk for unintentional self-harm or death caused by prescription drug overdose with this population. This population is at a higher risk for self-care deficit due to the effects of the mind-altering medication. Treatment: cognitive behavior therapy, along with group, family, and individual therapies, can help uncover the issues and help individuals cope in a healthier way. Specific concerns: risk for health by harm by others or to others. This population is at an increased risk for harming others and being harmed due to their impaired thinking and judgment caused by the drugs. Engaging in risky behaviors are linked to drug abuse and addiction. This population is often involved in criminal activities that can create a higher risk for causing harm or being harmed by others. Treatment options would be seek professional help and treatment to overcome addiction, refrain from drug abuse and risky behaviors, educate the vulnerable population on the dangers of prescription drug misuse, abuse, and addiction. And there are my references.